Welcome to Stories After Midnight. Today we're going to be reading The Lobotomy by Jarrett. I really hope you enjoy this story, and if you do, please consider subscribing if you're on YouTube or liking this video and episode wherever you are. I appreciate you for listening, and let's get started. In 1949, over 5,000 lobotomies were performed in the United States. This is the most horrifying example. Dr. Nathaniel Klein leans back in his chair and takes a long puff off of the wooden pipe drooping from his mouth. He stares blankly at the floor, thinking of nothing in particular. He is content and at peace with himself, his mind free from any distractions or intrusions. The smoke billows out from his cracked lips, clouding his aged features in a thick, hazy smog. He runs a hand through his full head of cropped gray hair and scratches at his prickly, equally gray beard. He is an innovator in his own mind, a man who gives more than he takes, a selfless healer who will change modern medicine forever. In reality, he lives in a shroud of false wisdom and consumes himself with outdated beliefs and unbreakable stubbornness. His pupils and students revere his teachings. He's their false idol. He speaks but refuses to listen. Dr. Nathan Klein will never admit to his own shortcomings because, in his mind, he has none. He is flawless, a righteous prophet walking amongst mere mortals. A knock at the door jars him from his inner sanctum. He looks up past the circular glasses hanging off his nose and sees the neurologist, Dr. George Clark, in his splendid white lab coat. Clark is younger than Klein by a good 20 years, putting him in his mid-40s. The overhead light beams off Clark's balding scalp as he smiles at the older man. "You ready, Nathan?" Clark asks, playing with a pair of surgical scissors, the way a barber would before a haircut. He opens and closes the instrument again and again. A meager smile barely forms on his lips as he imagines it slicing through brain tissue. Like his older companion, George Clark harbors an overwhelming God complex. He enjoys holding life in the palm of his hand. "No." Klein rises from his seat and launches into a coughing fit. He pounds on his chest with his fist until the hacking subsides. When it does, he says, "Allow me a few minutes and I'll meet you in the lecture hall at once." "Very well," Clark says. "Shall I prepare the patient?" he asks. Klein shakes his head. No, let me." Klein replies in a gruff voice and a dismissive raise of the palm. Clark nods and turns his back, exiting the small circular room. Dr. Klein turns to the curved, iced-over window and peers out into the frosty December morning. The snow falls in rough pellets that blanket the ground in a crunchy white sheet. He sees the students begin to walk over from the dormitories and decides to check on the patient for today's presentation. Inside the men's dormitory, on the university's campus, Andrew Moore hurriedly finishes the Windsor knot for his black tie. He stands in front of the mirror with his neatly trimmed, plump, black beard and long, wavy hair looking particularly sharp and well-kept. His roommate, Edward Taylor, is engrossed in a textbook. The title, Clinical Hematology, Theory and Procedures, is embossed on the cover. "Aren't you getting dressed for lecture today?" Andrew asks. Edward looks up and stops his incessant note-taking. His sharp-pointed nose takes a sharp inhale of breath before he speaks. "You're kidding, right?" Edward pushes his squared glasses up his nose so it sits flush against his brow line. Andrew's own brow line furrows into a wrinkled line of befuddlement. He stops tying his tie, his fingers still ensnared in the knot. "No? Why? What do you mean? I've never missed a lecture and I don't intend to start," Andrew says. Edward gives a slight chuckle, as if surprised that Andrew is even considering going. He rubs the back of his head, the high and tight haircut the same since his time in the service. Both men had served in World War II. They both enlisted the day after Pearl Harbor and once the war ended, applied and made it into medical school, where they soon became fast friends. Neither man thought of himself as gifted or talented, yet both were near the top of their class. And now, in their 4th year, they were tutoring others, regularly helping their classmates study and pass their exams, which were intensive and rigorous. "What's so funny? Why in the world would you want to mess up your perfect attendance? That's just plain dumb." Andrew berates Edward and pulls his tie down to lie flat across the starched white fabric of his dress shirt. "You don't know Nathan Klein. Guy's a damn quack. Edward spits the name like it's an insult to his tongue. I've heard the name, but why is he... Just go. You'll see. Edward flicks a hand at Andrew to shoo him out of the door. Andrew grabs his satchel of books and notes and begins to do just that, but at the last second turns back and sighs. Just come with me, he begs. Edward smirks and rises from the mattress. Fine, but I'm going to say I told you so, and only to keep my spotless attendance. He follows Andrew out of the dorm room and out into the hall, still in his pajamas. The two young men walk down the wooden stairs and push out into the frigid New York air. The sun struggles to peek through the clouds above, casting the area in a light periwinkle blue. The wind is bitter and nips at the men's ears as they tandem walk in the cold. Edward is still in his pajamas, and Andrew looks him up and down, blowing a breath in his hands to warm them. Professor's going to dock you for dress code, Andrew states matter-of-factly. The campus enforces strict rules on appearance, and for medical students especially. Suit and tie is required for all classes and lectures. The only time that one could dress otherwise is in labs with cadavers, and that's with full scrubs and protective gear. Yeah, well, call it my way of protesting. Andrew shoves his purple-tinged fingers into the thin pockets of his pajama pants. When this doesn't work, he vigorously rubs his arms up and down. The effect is negligible, and he looks uncomfortable. And well, he should be. Lake effect wind in early December can give someone frostbite. Why do you hate this guy so much? Andrew asks. And Edward shakes his head in a smug, almost defiant manner. Like I said, you'll see. Inside the back room of the lecture hall, Nathan Klein gazes upon Beverly Clifton, a 31-year-old housewife from upstate New York. Her head is shaved down to the bare scalp, and her eyes are ablaze with hostility. Rearing back, she spits in Klein's face. The old man gives a rough smile and wipes the glob of phlegm from his eyes, flicking his glasses the way an artist wipes away unwanted paint from a brush. Come on now, he says in a soothing tone that is anything but convincing. That's not necessary, is it, Beverly? He resets his glasses to their usual perch on the tip of his nose and steps towards the cursing woman. She is bound in a tan straitjacket, her arms crossed in front of her chest. She twists and struggles in a futile attempt to free herself from her restraints. Two women nurses place their hands on her shoulders to stabilize her and limit her thrashing. Their white gowns fit snugly against their bodies and fully cover any skin that would otherwise be exposed. I've been told that you're rather unruly and suffer from manic episodes, and I can see that George's initial assessment seems to be accurate. He says more to the nurses than Beverly. She spits again at the doctor, the ball of saliva careening towards him. He steps back and shakes his head as it splatters on the wooden floor. Mask her to keep her from spitting again, Klein says. One of the nurses nods and steps out of the room. She returns a moment later with a surgical mask. Beverly shakes her head and collapses her chin in defiance as the nurse tries to slip the ear loops over her ears. The other nurse pins her against the wall and uses her gloved hands to stabilize Beverly's head. The mask is placed over Beverly's mouth and nose and is forcefully pulled down below her chin. She hurls swears at the nurses and tries to kick one unsuccessfully. She fires more insults to Dr. Klein, but these bounce off the old man and harmlessly fall to the floor. Put her in the wheelchair and have Dr. Curtis prep her, Klein says, as he turns his back and enters the main lecture hall. The nurses nod and force Beverly into a wheelchair after a brief struggle. She tries to leap up to her feet, but is held down by the nursing staff. She is wheeled into a small prep room. The floor is covered in dull green tile, and the walls are a faded shade of white. A metal gurney adorned with leather straps is situated in the corner. A metal gurney adorned with leather straps is situated in the center of the room. She bucks and twists as she is lifted from the chair and up onto the gurney. Standing in the lecture hall, Klein sheds his suit jacket, rolls up the sleeves of his white dress shirt, and washes his hands in a large metal corner sink. He scrubs up to his elbows vigorously until the soap forms a thick white lather, then rinses it off with cold water. The bristly arm hair stands up as he dries off with a sterile towel. The woman's muffled screams can be faintly heard through the wall. He hears footsteps behind him and turns. He sees the anesthesiologist, Dr. John Curtis, approaching. Curtis already has a mask covering his face and a cap obscuring his hair. His eyes wrinkle in a hidden smile. John? Klein gives a slight nod and tight smile. Nate? Curtis returns the brief greeting. What do you plan on giving her? Klein is less inquisitive than his tone suggests. Well, she's being rather... Curtis pauses, searching for the right word. Uncooperative. So I have her on a 0.5 milligram atropine IV drip to calm the heart rate and reduce saliva and mucus secretion. Afterwards, I will introduce an intramuscular thorazine antipsychotic, 30 milligrams. I'm having the nurses administer slowly to avoid hypotension or any such instance of low blood pressure. Klein nods approvingly and turns to the volunteering student scribe by the chalkboard and instructs him to write anesthesia process on the top margin. The scribe copies Curtis's explanation as the anesthesiologist turns his back to Klein, focusing his rambling on the student. Once the patient is secured on the gurney and ready for surgery, we will administer anesthesia. From her weight of 135 pounds, this will consist of 40 milligrams of thiopental via IV injection. The induction dosage will be on 4 milligram intervals to monitor patient response. Curtis pauses, allowing the scribe to catch up. He has to write small to fit everything in the margins of the chalkboard. Dr. John Curtis has just made a fatal error, yet is too preoccupied to catch it. He is garrulous and eager to get his demonstration over with. However, for a patient of Beverly's weight, 200 milligrams of thiopental is necessary for total sedation. John Curtis is a staggering 160 milligrams off the target dosage. His catastrophic miscalculation goes unnoticed by the scribe and Dr. Klein as he continues his spiel. How this miscommunication occurred is unclear, but what is clear is that this will put into motion events so harrowing, so traumatic, and so cruel that it's tantamount to human experimentation. Curtis goes on. After the operation concludes, I'll deliver an analgesic painkiller, preferably morphine, depending on what we have on hand. If it is morphine, and I'll confirm in a second, it'll be anywhere from 2 to 5 milligrams depending on the patient's needs. Got all that? Curtis has run out of breath behind his mask, the long-winded explanation leaving his lungs empty and drained. The scribe nods and shakes out his cramping hand. Outside, Edward and Andrew make it to the lecture hall, their extremities substantially colder than before. They hurriedly push open the entrance doors and are flooded with a radiant warmth that stings their chilled flesh. They shiver and kick the snow off their shoes before walking upstairs into the main hall. Andrew and Edward settle into their seats. The medical lecture hall resembles a small theater, its U-shaped design creating an intimate setting. 2 tiers of wooden chairs arranged in lower and upper decks can accommodate up to 20 students. The center of the room features an open, well-lit area dedicated to presentations, typically consisting of surgeries or other medical procedures. Andrew recalls the first time he sat in this room. It was his first year of pre-med, and he witnessed a cesarean section on a 3rd trimester pregnancy. The child was breached inside the womb, and the doctors explained that the only way to salvage the delivery was a C-section. The mother's life was over, regardless of the outcome. Andrew felt like he was watching a murder take place, as the surgeon opened up a large circular incision around the woman's rounded stomach. It looked like a sanguineous, deflated balloon. He had never seen that much blood before, and the numerous instruments sticking out of the gaping wound made him turn away and gag. He was repulsed, as were his classmates. Many turned away, and some had to leave the room. He supposed that the gory demonstration had accomplished its intended goal, separating the hardened men from the squeamish boys. That was the first time Andrew had doubts about becoming a doctor. His father had been a doctor, and so Andrew supposed he was born into the profession, but he had never expected it to be so hard to stomach. And so now, as Andrew opens his notebook and copies the anesthesia notes from the chalkboard, Edward leans into his ear and whispers, "Don't waste your time, this guy is insane." Andrew ignores him as he slips his pencil into his mouth, holding it the way a seamstress would hold a needle while hemming a dress. They can both hear faint shouting and screaming echo off the walls. "Is that?" Andrew begins, but Edward leans in again to cut him off. Yeah, it's their patient. She's being held against her will back there. Andrew turns his head to face him. He slips the pencil from his mouth. What? Why? Why would they? Electroshock therapy, Edward says bluntly. Andrew gives him a stunned look. What? Are you serious? Yeah. They take charged earmuffs and shove it over the head to induce seizure, and eventually unconsciousness. She's convulsing back there as we speak. Edward leans back in his chair and shakes his head. After a strained moment, the screaming in the other room abruptly ceases. Stuffy silence permeates the lecture hall. And she finally just passed out. Edward wiggles his finger in the air like he's casting a spell. He stares blankly at the floor ahead of him, as if trying to cut off the cascading emotions that well up within him. You don't know that's what they're doing, Andrew says. He still has a slimmer of hope and wants to keep faith. Edward squeezes his eyes shut and rasps. Yeah, I hope not. He blows out a breath and leans back in his chair as one of the doctors walks to the center of the room. All the chairs in the hall are now occupied by either students or faculty members. Hello, everyone. I'm Dr. Nathaniel Klein, he says in a soft yet commanding voice. The students mumble a disjointed hello back to the old man. This is Dr. Jonathan Curtis, anesthesiologist for today's operation. He points to the masked man standing to his left, as another balding man pushes through the doors and into the hall. And this is Dr. George Clark, neurology. Klein claps his hands together gently as Clark dons a medical cap, face mask, and yellow rubber surgical gloves. Andrew rubs his eyes nervously. What is he about to witness? Today we are going to demonstrate for you the prefrontal lobotomy. Klein strolls to the chalkboard, where a side-view diagram of a human brain is already drawn. I know that there is another variant of this procedure, the transorbital lobotomy, in which a sharp pick instrument is inserted into the eye socket and used to puncture the surrounding bone to access the brain. We will not be undertaking this variation, since its accuracy is disputed. I just wanted to get that out of the way. Now, before we begin with the operation itself, allow me to break down the areas of the brain we will be operating on and explain the various structures we will be severing. Klein picks up a stick of yellow chalk and begins to write with sloppy penmanship. The goal for today is to alleviate certain mental disorders in our patient. Our patient has exhibited numerous irregularities, including irritability, temper tantrums, hostility, and belligerence. I have personally observed her and believe this operation can help lead her back down a path to normal, well-adjusted behavior. His back is turned to the class as he writes, the chalk screeching down the board in quick bursts. The prefrontal lobotomy consists of slicing or severing the white matter in each frontal lobe of the patient's brain. This will be performed within the plane of the coronal suture, which, as you should all know, is connective tissue that separates the skull's frontal bone from the two parietal bones. He shades in the front area of the brain and draws dissecting lines through it. This plane will pass anterior to the frontal horn of the ventricle. He points to the lines he has just drawn. I told you. Edward leans in and whispers to Andrew. Klein notices and narrows his already wrinkled eyes in disapproval. Perhaps you would like to teach the class? Klein spreads his arms in an insincere gesture. Edward bites the inside of his cheek harshly. He wants to stand up and shout, wants to scream in this charlatan's face. Instead, he swallows his pride and submissively shakes his head. Good. Please refrain from further disruptions or you'll be asked to leave. Edward is screaming in his seat. Andrew can feel the angry heat radiate off of him. As I was saying, Klein clears his throat. The coronal suture is located approximately 12 to 15 centimeters behind the glabella, which runs along the top of the skull. He draws a short, jagged X within the front half of the brain diagram. 6 centimeters behind the zygoma, along the suture, is where we will make the opening. This will be done with a drill, and this corresponds to a point along the frontal crest on the interior of the skull. The X I just made marks the exact spot where we shall drill through the skull. Andrew jots down notes as the doctor speaks. He glances over to Edward, who appears disinterested and unengaged. It is imperative that the frontal crest not be breached during the drilling process, otherwise major arteries can be lacerated or even severed, and, well, that could result in a rather large mess. Klein gives a dry smirk, and some of the students respond with a short burst of chuckling. Once the holes on each side are drilled, we take our Lobotomy. He walks over to the instrument table and holds up a surgical device that resembles a modified butter knife. And after careful insertion, use a sweeping fan-like motion to sever the white matter tracts, connecting the prefrontal cortex to the thalamus. This procedure is, of course, bilateral, meaning the process will need to be repeated for both the left and right sides. After walking back over to the board, he draws a circle in the lower half quadrant of the brain diagram, around the X he previously marked. He then makes sweeping diagonal lines with the chalk that indicates the movement of the knife inside the brain. Any questions? Klein asks. No one raises a hand. Klein scans the crowd for a moment and, seeing no takers, loudly claps his hands. All right, shall we begin? Klein asks the nurses and 2 doctors alongside him. They all nod in agreement. Klein sheds his suit jacket and replaces it with a white operating gown. He covers his face and hair just like his colleagues and motions for the patient to be wheeled in. Several nurses push past the revolving doors and return moments later with a metal gurney. The casters screech in protest as the gurney is wheeled over the bumpy wooden planks. Andrew cranes his neck and sees a young woman strapped down in the gurney. A hushed whisper falls on the spectators. You sure you want to stay? Edward asks. Andrew remains facing forward but grimaces slightly. He doesn't offer a direct reply, but Edward can tell Andrew is bothered. An IV stand is held beside the gurney with a clear, plastic tube running from a strung-up bag into the woman's thin arm. The gurney is pushed by the nurses until it rests in the middle of the room, in clear view of the entire audience. Laying on the gurney, Beverly Clifton feels her mind race. Her mouth is gagged with a towel, and the bright overhead lights sting her eyes. Her vision blooms with an array of colorful, bouncing splotches that mask the colorless ceiling. She can feel the atropine drip flow through her bloodstream. Despite its intended calming effect, Beverly is restless and nervous. She pushes against the straps that bind her to the gurney, but finds herself immobilized. The metal is hard and cold under her. She flicks her eyes to the right and sees the vast array of surgical instruments. The sharp, glistening knife edges and the lengthy drill bits scattered about the side table make her stomach churn and her bladder seize in painful spasms. The doctors and nurses bustle around her with rapid footsteps. She can hear the main doctor, that old bearded man, give a speech to his students. His callous, almost detached demeanor gives her the creeps. It's like he enjoys this, revels in the ruination of someone else's mind. Beverly hears a sound to her left. She turns to see the IV bag being swapped out for another. Curious, she squints to see the label, but when she does, she can't decipher the overly long word nor understand its effect. Suddenly, as if reading her mind, a masked man walks up to her and stares down with cold eyes. It's Dr. John Curtis. All right, Beverly, you're going to go to sleep now, he says, flicking the crook of her elbow with his gloved index finger to find a suitable vein. When he does, he grabs the IV needle and says, Okay, slight pinch in 3, 2, 1. He jabs the needle in, and Beverly gasps through her gag. The needle is long, and the pain explodes before rapidly fading away. Her arm pulsates in rhythm with her heart. The beat is fast and staccato-like. Okay, count down from 10 with me. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Beverly Clifton's world morphs into darkness. Dr. Klein walks over to Beverly, who is now sedated. Her breathing is deep and measured as he stands over her tied-down body. He gestures for a stool and throws himself into it, the wheels shimming loudly on the floor. Curtis and Clark take their positions on opposite sides of Beverly. Scalpel, Klein orders. One of the nurses goes to the side table, picks up a long, razor-sharp scalpel, and places it in Klein's outstretched hand. The old man turns to the medical students. We'll begin by making 2 bilateral incisions into the patient's scalp. one horizontal and one vertical. Notice the rubber dam underneath the patient's head to keep the bleeding contained to the gurney. He points to the black pillow-like headrest underneath Beverly's head. I will now make a curved incision just above her eyebrows, extending this cut laterally to the temporal regions on both sides of the brain. With shaking fingers, Klein presses the scalpel deep into Beverly's flesh. He sticks the knife into the right side of her head and, with an increase of force, breaks the skin. The blood begins to bubble and trickle out from the initial puncture. Klein keeps his gloved hand steady as he runs the wickedly sharp blade over the entire length of the woman's head. The straight line becomes a dark, wet red as the blood flows down the back of her head like a waterfall cascading down a cliff face. The nurses and doctors keep her head from moving or jerking as Klein completes his incredibly long incision. And now for the vertical slice. He repeats the process of cutting into her scalp, starting from the top of her head and working his way down to the base of her skull. Her head is now separated into 4 bloody quadrants, like a graph on a math test. Now, he says, we will peel back the skin and underlying muscle of the scalp, revealing the patient's skull. We'll be able to see the bone momentarily. Klein uses his hands and retches back on the flesh. Squelching and ripping fill the lecture hall. Up in the audience, Edward covers his eyes in disgust. God forgive me for witnessing this, he thinks to himself. He has always been a devout Catholic, and this savage display reaches deep into his center and tears something loose within him. This is wrong. So very, very wrong. It feels like a sin to be sitting here, allowing an innocent woman's brain to be jumbled into pudding. He should do something. Jump up. Tackle the doctors. And then what? Get suspended? Possibly even expelled? Maybe that wouldn't be such a bad thing. He's seen gruesome sights before back in Okinawa. The worst time was when his platoon used flamethrowers to clear out the Japanese hiding in the caves. He didn't kill anyone that way himself, but he never forgot how they stumbled out, flailing their engulfed arms wildly in the air, how their animalistic howls of agony sounded. He saw some of those dead bodies, how burnt and crispy they got. He never thought anything would ever topple the PTSD from seeing those men. But now, as he sits here watching this woman get mutilated, he wonders if this is indeed worse, because at least there were no false pretenses in war. Sure, it was brutal and sometimes barbaric, but it was necessary, because it was either you or them. Yet this was all pseudoscience. This woman might have a few screws loose, sure, but cutting into her brain would not help in any meaningful way. And yet the doctors are saying otherwise. They're proud and confident enough in their methods to teach it to a group of young, aspiring medical practitioners. Shame on them. Sitting next to him, Andrew shares Edward's sentiments exactly. He's repulsed, but he has no idea how bad things will get. Not even close. Down on floor level, Clark places hemostats, small scissors with plugs on the end, into Beverly's scalp vessels to stem the excessive bleeding. They're suspended from Beverly's flesh, looking like ghastly ornaments hanging from a Christmas tree. As Clark does this, Klein continues on with his instruction. Now with the hemostats in place, we will proceed with the trepanning. Nurse, drill please. The same nurse who handed him the scalpel hands him a hand crank drill. The drill is a long metal shaft. The handle dips downwards to give an unimpeded rotation. The drill bit on the end has long, jagged teeth, easily enough to take chunks out of human bone. Klein takes the drill, and with Clark's hands holding the scalp folds back, begins to twist the handle. The drill bit bites into the skull as white chunks fly up into the air. A sickening crunch sound reverberates off the ceiling as Klein begins to bore the hole on the right side of Beverly's head. He rapidly spins the handle of the drill, the head of it rotating and carving into her. After several moments of this, Klein steps back and examines the hole. He shakes his head and drills several more times. This time he finds it deep enough and nods to the nurse who pulls it free from his grasp. Klein rotates the gurney, showing the supple pink flesh underneath the stark white bone. As you can see, the brain is now visible, he says, turning the gurney back to its original orientation. The hemostats wiggle and gyrate with the motion, bobbing like apples in a barrel of water. Nurse, the Lobotomy, please. Klein asks for the knife-like instrument. The nurse hands it to him. the sharp metal glistening from the overhead light. Edward has seen enough and bursts out of his seat, red-faced and enraged. "You're a damn fraud! You hear me, you son of a bitch? A no-good damn fraud!" He stomps his feet on the floor and jabs his finger toward Klein so forcefully that his shoulder pops. Heads turn and mouths drop open. Everyone is staring at him. Andrew discreetly tugs on his arm, urging him to sit down. Edward ignores him. "That's right. I said it. You're killing this poor woman, and I'm supposed to sit here and take it? Like hell. I'll tell you what, you lousy quack. I saw some awful things during the war, but I've never saw anyone torture someone like this. This is ridiculous. I'm walking out. Who's with me?" "Get this man out of here," Klein shouts behind his mask. "No, not until you sew that woman up." Edward is too irate to realize his blatant contradiction. "Or what? What will happen if I continue? What will you do about it?" Klein folds his arms incredulously. "You leave her brain alone. You hear me, you bastard? Leave her mind be. That's hers and hers only. Don't you dare go scrambling it. I swear to God, if you do, so help me, I'll—" Just then the outside doors to the lecture hall burst open, and 2 security officers stand, nightsticks drawn. Their eyes fix upon the operation, and their faces pale into a look of vile repulsion. "You must leave at once," Klein demands. Edward slams his chair back and kicks it as he steps into the hallway, towards the 2 security men. Still in his seat, Andrew's heart races 1,000,000 miles a minute. His knees shake uncontrollably. What just happened? Edward was screwed. He'd never survive this. He'll be expelled by the end of the day. Should he align with Edward in his protest? Andrew considers this, weighing his options. He likes none of them. He stares down at the butchered woman and squeezes his eyes shut, knowing Edward is right but feeling too cowardly to join him. He can only imagine what it's like on that godforsaken gurney. Cutting through her delirium, Beverly's mind flashes back to her upbringing. Bits and fragments come in and out of focus, but one memory stands out vividly. She's 11, a little girl again, and she's playing in the backyard, running around in the treehouse her father has built for her. She climbs down the ladder, carved into the trunk, and swings off a branch, landing on her feet with a giggle. Her mother calls for her to be careful, but Beverly doesn't hear it. She is running around in the grass now, taking in the warm summer sun. It's hot, but not too hot. The breeze rustles her sundress as she picks up a dandelion from the ground and examines the bright yellow petals. This is happiness. True, untarnished joy. She breathes in the fresh air and laughs. Suddenly, the sun above is obscured by dark gray. Beverly blinks and sees storm clouds moving in. Huh, where'd those come from? They hadn't been there a second ago. Now the wind picks up, blowing leaves up and around in forceful gusts that stick to Beverly's face and cling to her hair. She peels them off as the rain starts to come down in buckets. She is drenched to the bone and looks around in a panic. Wait, wasn't she with someone? Who? Why can't she remember what the person looks like? Maybe no one had ever been there. A thunder claps in the distance. Beverly jumps. She trembles, mainly from the cold, but also from the fear of the approaching storm. She wants to go inside, but is lost. Nothing looks familiar except the treehouse. She scrambles up the ladder and huddles in the corner, the rain peppering the roof in a constant patter. Suddenly, a massive flash and a bolt of lightning strikes the tree right down the middle. She sees a blinding light in her vision, blooming and spreading and all-consuming like the world's worst migraine. When her vision returns, she sees a roaring flame spread throughout the treehouse. It's orange and rolling and churns with each howling flurry of wind. She tries to climb back out the way she came in, but the ladder is burnt to a crisp. She can't escape. She looks outside the window and gazes upon hellish flames that reach upwards to infinity. Fire is everywhere. Nothing is spared. Nothing is left. She is all alone and has nowhere to go. Then it all comes rushing back. Dr. Nathan Klein has finished his first cutting. It went by so smoothly once that disruptive hooligan left. Damn, what was wrong with that kid? He had no respect for authority, no ability to look beyond the blood and see the net positive. There were so many benefits to the lobotomy that boy hadn't seen. How could he possibly know what's best for Beverly? He had no idea. Dr. Klein removes his hand from her brain and flicks the bloody droplets from the white latex covering his fingers. He looks up at Curtis, who appears to have drifted off. Well, that's fine. It's not like he's urgently needed since the patient is... Without warning, Beverly's eyes open. They shoot awake like someone who had just received an electric jolt. Klein jumps back in surprise and lets out a short yelp. The nurses gasp in alarm and Curtis's eyes bulge out of their sockets. Dr. John Curtis has just realized his error, an error of such colossal magnitude that his career as an anesthesiologist is all but over. Only seconds before, he had been a respected doctor in the medical field. Now he was a man presiding over a torture session. Beverly's mouth contorts and she screams into her towel gag. The fabric does little to muffle the sound, nor diminish the astronomical amount of pain that she's experiencing. Her jaw unhinges, and the towel falls down below her chin, her shrieking now unmuffled. The brain would normally shut itself off in an instance such as this, but due to the thorazine antipsychotic Curtis has already given her, her brain is unable to render itself unconscious. So, Beverly Clifton feels everything. Her exposed brain, her degloved scalp, the literal hole in her head. A wet spot of urine puddles onto the metal gurney as the medical staff is thrown into absolute chaos. Her legs convulse like she's being electrocuted, and some of her muscle contractions are so violent that the leather straps start to tear free. She jerks in spasms and bucks, flailing about on the gurney like someone possessed by a demon. Yet, this was worse than any possession. "Knock her out! Knock her out, damn it!" Klein's voice bellows to Curtis, who sprints back through the revolving doors and into the supply room. He runs into a cart, knocking over testing vials and chemistry glasses. They shatter into a million pieces as he sprints past it, throwing open cabinets, doors, anything that has drugs in it. His heart is in his throat as he hears the woman's howls. They're barbaric, almost inhuman. They remind him of the time he took his wife and kids to the zoo and they saw the ape exhibit. She sounds just like those creatures, but worse. More primal, guttural wails, piercing cries, anguished shrieks, like her very soul was being torn apart by God. Andrew feels his gorge rise and can't hold it back. He blows breakfast on the floor in a repugnant greenish-brown bile that splatters his dress shoes. He picks food particles out of his beard and immediately jams his fingers into his ears. He can't bear to listen to the sounds the woman's making. He'll go insane if he has to keep hearing it. But he can't stand idly by and watch this woman suffer. He has to do something. Mustering up courage he hasn't felt since his days as a Navy sailor, he sprints down onto the floor, past the convulsing woman, and through the revolving doors. He yanks his fingers out of his ears, but still can't bear to look at the agonized woman. He pops his eardrums to muffle the screams, but they still penetrate with ease. His eyes fix on a brightly lit hallway. He sees a room to his right with large windows and a doctor frantically searching it. Andrew bursts through the door. "What do you need?" Andrew asks. Curtis turns to him, his voice sounding dire. "Morphine! Dale, I need morphine! Find me a 5 milligram syringe now!" he shouts. Andrew turns to his immediate left, seeing vials and syringes of varying shapes and sizes inside a glass cabinet. He throws open the doors and searches each one, looking for 5 milligrams. 5 milligrams. Where? Where is it? There. He snatches it up and hands it to Curtis, who lifts up 2 separate glasses of clear liquid. "Here, sodium thipental. Take it and follow." He shoves the glass into Andrew's chest. Curtis runs as he pours the morphine into a vaccine vial, spilling some of the drug onto the wooden floor. He doesn't have time to clean it up. Curtis pops the needle onto the syringe and pulls the plunger back as he bursts into the lecture hall. He sprints past the neurologist, Dr. George Clark, who is frozen in place. His mask is off, his mouth sprung open in absolute terror. His fingers tense up into white-knuckled claws that dig into the sides of his head. He attempts to move, tries to assist in helping, but he is unable. Doubt floods his brain. He doesn't want to be in this room anymore. He wants to walk out the door and never look back. Curtis winces as the woman screams. He presses the morphine needle into her vein. Without hesitation, he pushes the clear liquid in and steps back turning to Andrew. Sodium, thiopental, put it in her IV bag now. He has to shout through Beverly's screams. With trembling fingers, Andrew reaches up and pours the glass of anesthesia into the bag. The liquid trails down the clear plastic until it reaches the bottom of the reservoir. Andrew traces with his eyes and sees the liquid begin to run through the line and into Beverly's arm. He sags back against the sink as Beverly's howls subside. Andrew wipes the sweat off his brow with the sleeve of his suit jacket. He's hyperventilating, unable to catch the breath that eludes his lungs. The sheer adrenaline from moments before has morphed into a full-blown panic attack. Feeling his legs turn to jelly, he collapses down onto the floor in a crashing heap. He sees a blur of movement and glances up, seeing Curtis standing over him. Thank you, Dr. John Curtis says, staring down at the floor. He was too ashamed to make eye contact. Andrew gives a nondescript nod as the two men exchange nothing further. Shall we, continue with the operation? Andrew hears that familiar aged voice and knows who it is. Dr. Klein. Why, are you kidding me? Clark snaps in profound agitation. Yes, we must proceed immediately, Klein says. No, to hell with this, Clark says, ripping off his blood-stained gloves and tossing them in a biohazard container. She was downright delirious. I will not oversee the remainder of this surgery. It's too risky. Clark sheds his lab coat. You're not serious, are you? Klein asks. Clark stares hard at him. His lips move, but his brain is too bewildered to form coherent sentences. Finally, he sputters. Yes, I'm serious. You've made that poor woman suffer, and I will not stand here as a neurologist and partake in it. I took an oath, and so did you. Clark jabs a finger at the older man and storms out of the lecture hall, taking the same path Edward had only moments before. The students break out in muffled whispering. Where do you think you're going? Come back here. I'll have your medical license revoked for this. Klein shouts. Clark pauses mid-gait and turns his head to speak over his shoulder. Go ahead. Do your damnest. Clark takes 20 minutes out in the lobby to compose himself, before pushing past the lecture hall doors and out into the vestibule. As he is walking out, he sees Edward leaning against the outer doors that lead outside. The security guards have told Edward to leave, but he doesn't want to walk outside in the cold wearing only his pajamas, so he lingers. Clark looks at the young man and frowns. He turns to him in the small, contained room. Can I ask you something? Edward looks up. What? Why are you here? Clark throws his suit jacket over his shoulder. What do you mean? Why do you want to be a doctor? That's no way to strike up a conversation. Just answer the question. Clark's demand is gentle. Edward hesitates. Because? Edward trails off. Because why? To help people. Edward knows the response is canned, but he can't bring himself to say the real reason. Let me get this straight. You interrupt a lecture from one of the country's most revered neurosurgeons and expect me to believe that it's because of some altruistic reason? Yeah, I do, Edward says. Bull, Clark says. You're not here to help people, are you? What the hell are you getting at? Edward unfolds himself from the door and takes a step towards Clark, who backs up. Clark holds up his hands in a passive gesture. Nothing. I'm just wondering, that's all. I'm here because I want to be. Why do you care? Edward says. Clark shakes his head. No, you're not here because you want to be. You're too hot-headed. Most med students I've taught or interacted with are all like sponges. They don't question what they're being taught. But not you. I know your type. Never satisfied, always questioning authority. Yeah, well, Klein's a fraud. What was I supposed to do? Edward says. Clark gives a knowing sigh and leans back against the door next to Edward. The two men stare at the wall together. Are you a religious man? Clark asks without looking. Edward shrugs. I was raised Catholic. You go to church? Edward shakes his head. No, I used to when I was a kid, and my parents forced me. I guess I stopped going once I watched my mama die. She died from cancer, rotted out from the inside. Edward laughs harshly, but there's not a shred of humor in it. You know the funny part? She prayed every day. Every damn day. Didn't do a thing for her. That's when I knew it was all hogwash, the whole thing. Church, prayer, God. It's all a load of crap. He crosses his arms and sighs, throwing himself back against the door. You serve in the war? Clark asks after a long while. Edward nods sullenly, and Clark can see this out of his peripheral vision. Where? Pacific? See any combat? Yeah. A lot? Yeah. Were you ever forced to kill someone? Clark asks. Edward waits and waits until Clark is ready to speak. Just as he opens his mouth to follow up, Edward says, Yeah. The voice is raspy and muffled, ashamed even. Clark lets out a breath. Regret it? Yeah. Edward thinks back to the caves on Okinawa. He has convinced himself that he wasn't holding the flamethrowers. Maybe he wasn't the one that stood at the mouth of that cave and sprayed it down in hot orange flame. But he was. He tried to tell himself he didn't like it, that the Japanese deserved it for all the war crimes they had committed, that the smell wasn't delicious and the screams weren't music to his ears. But they were. He has a god complex and loves holding life in the palm of his hand. He can't help but feel important, needed, powerful. No, you don't, Clark says. Edward feels himself tense up, feels his tongue turn to sandpaper. Don't feel bad. I've worked with the type. Ironically, the best doctors in the world. How do you know that? Edward has never felt more exposed, more seen through. His walls are crumbling. Let me tell you something, kid, Clark says. You only joined the medical field for 2 reasons. To help people or to hold power over them. That's it. Oh yeah? Edward spits. So what about you? Clark doesn't hesitate. It started with the power trip. There's nothing on this earth that compares to standing over someone during surgery. But Nathan is different. We've gone back years, but he changed somewhere along the way. He enjoys ruining lives. Or maybe I did at some point too. I don't know. I like to think that I can help and do good. I suppose I stayed with him because I wanted to limit his destruction. Or maybe I was too blind to see what a psychopath he really is. You already know the lobotomy is a failed operation, with over 80% showing negative outcomes. But I knew that he was going to do them with or without me. And maybe if I can tell him where to drill, where to sever, and where not to sever, the patient won't have to suffer as much. But they still suffer regardless, Edward says. Clark pauses for a prolonged moment, then asks, Did the people you kill in the war suffer? No, Edward says, his eyes staring forward and unblinking, their determination faltering. Clark's tone softens. I think they did. And I think you enjoyed it. And now you regret it, which is why you're becoming a doctor. Your mother died and you couldn't do a damn thing about it, and that eats you up, doesn't it? You're here to make yourself feel less guilty. That's why you blew up earlier, because you didn't do the right thing before. You want to atone for past sins. Clark says. Edward shakes his head. Get this off your chest. Clark pats him on the shoulder. I've done some horrible things during my time as a doctor, and I can tell you from experience, confession is good for the soul. Edward's face scrunches up and he loses it. Yes, they suffered. By my hands. Edward Taylor is finally being honest with himself. And so, as he stands in the vestibule, he breaks down and starts to sob. Back in the clearing out lecture hall, Curtis jabs a finger in Klein's face. Sew her up, he demands. Klein shakes his head definitely. No, she will see more long-term benefit by us continuing. I can't in good conscience do that, Nathan. Must I remind you that this is your fault, John? Not mine, but yours. He jabs a finger in the anesthesiologist's face. Curtis shrinks back. I didn't mean to. It was a mistake. Yeah, well, you should have known the correct dosage. Down on the floor, Andrew clenches his fists tightly to dispel the tremor that rocks them. With shaky knees, he rises to his feet to see the 2 doctors arguing vehemently. He sees Curtis back away and stand at Beverly's side. Klein storms over to the instrument table and grabs his scalpel from the table. Andrew's chest constricts in alarm. What is he doing? If no one will let me finish this operation, I'll do it myself. The hell with all of you. Klein shouts into the air as he takes long, angry steps towards the unconscious woman. Andrew sees Curtis reach out to stop him. With an enraged snarl, Klein swipes the scalpel at him. Curtis cries out as a long, curved laceration opens on his forearm. Andrew can't breathe, can't bring himself to move, but he has to do something. He stumbles over, his legs still rubbery, and leans on Beverly's gurney. "Don't," Andrew says. Klein gives him a hard look. "This is my patient. I will do whatever I please." The old man screams so loudly, drops of spit fly onto Andrew's face. Klein can't handle not being in control, or the constant barrage of questions. For the first time in his long life, he feels impotent. He's lashing out wildly at anyone who dares question his intellect. "Just don't hurt her," Andrew says calmly. "He already has," Curtis says from over Andrew's shoulder. Klein's face reddens further. "You damn moron," Klein bellows. "I'll cut you again. Suddenly, his eyes bulge. His gray beard lifts as his mouth morphs into a shocked, rounded expression. His hairy hand clutches his chest as the old man crumbles to the ground, moaning and writhing in agony. Andrew can tell immediately what has happened. It's the telltale sign of a heart attack. But Andrew doesn't squat down to help him. There's enough medication and equipment here to most likely save Nathan Klein's life. But no one moves to save him. They stand around him, looking down, unmoving. Perhaps it's the way he attacked his colleagues. Perhaps it's his very demeanor. Regardless of the reason, Dr. Nathan Klein, a genius only to himself, a trailblazer to no one, and a man whose patients die in asylums, fades away in a nearly empty room. "Guess his heart couldn't take it," Curtis says to Andrew. Andrew nods meekly. "You know how to suture?" Curtis asks. Andrew nods again. "Good. Help me sew her back up. We're done here." "What about the pieces of her skull? Don't we reconstruct it?" Curtis shakes his head. "No, we don't want to increase the chances of infection." "Okay. Where do we start?" One day later. "You saved her," Edward says as Andrew finishes recounting his experience. The winter sun bleeds through the blinds of the dorm room. "I don't know for sure. She's likely to have issues for the rest of her life. She's stable and coherent. They're surprised she isn't worse." Andrew shakes his head and stares at the floor of his dorm room. "How do you know?" "I have a friend in the psychology wing. He says that she probably won't make a full recovery, but she still has partial use of her body and her motor skills are unimpacted." "Thank God. It could have been worse had Klein finished the lobotomy," Edward says. "I guess." "I heard that you stood over him and watched him die," Edward says. He can see Andrew flinch from the words. "Who told you that?" "Heard it from the others who were there. Only a handful stayed in the room, I guess, but enough to see you and Curtis watch Klein die." "Well, maybe I did, and maybe I didn't. I don't approve of people like him." "He tortured her, Edward. Tortured her." Andrew frowns as he stares off into space. "No, Dr. Curtis did. He messed up his drug ratios." "Yeah, he was part of it." "What happens to him now?" Andrew asks. Edward shrugs. "Probably go before a medical review board. And then what?" "Hopefully he'll get his license revoked," Edward says. Andrew's eyes moisten but no tears fall. "What's wrong?" Edward asks. Andrew looks up at him. "I'm not sure this is what I want anymore," he says. "That's funny. Me neither," Edward says. "Really? Why?" "Conversation I had with George out in the hall." "The neurologist?" "Yeah," Edward confirms. "After you left?" "I caught him on the way out." "What did he say to you?" Andrew asks as Edward pulls open a backpack and stuffs clothes into it. "Something that saved my life." "How so?" "Maybe doctors don't do as much good as we think we do." 1 week later. In the psychology wing, Beverly Clifton drifts off to sleep. The jagged lines in her scalp are turning from an angry red to a soft, fleshy pink. She is dreaming again and can see that familiar treehouse in the backyard it stands in. She can see the other person who was there, her mother. She stands on the other side of the yard. Beverly looks around. She sees the churning flames behind her, burning her back. She turns back to her mother, basked in a bright white light. Does she dare? Yes. Yes, she does. She sprints through the soft green grass, past the treehouse and into her mother's arms. Her heart monitor flatlines. For the first time in a long, long time, Beverly is at peace. And that's the end of this wild story. I really hope you enjoyed it. If you did, let me know in the comments. What a crazy one this one was, eh? Anyways, wherever you're listening to, I appreciate you for being here. If you'd like to support Stories After Midnight and help things continue on, well, join the Patreon. I would love to see you there, and your generosity would be greatly appreciated, but, I mean, it's not the end of the world. There is a Discord, too, if you'd like to come join. That'd be pretty cool to see you there. It's growing a little bit, but it'd be nice to have more of you. And if you'd like to send me your stories, go to storiesaftermidnight.com, where there will be a link to do so. But regardless of all that, I thank you for listening. I hope to see you in the comments, or at the very least, I hope you listen to the next episode. So, without further ado, we'll see you then.